With less than 2 months now until the election, political ads are trying to influence your vote. You see them all day, every day. But what's fact and what's fiction in those?
Before you cast your ballot, we are digging into some of those ads with a series called Truth Be Told. And new this morning on 41 Action News Today, we're taking a closer look at one ad from the Kansas Senate race.
Percy Monroy lives with diabetes, a disease not cheap to manage.
Medicines and the diabetes medicines, they are expensive.
Monroy is from Guatemala and has lived in the U.S. for 20 years. With help from an interpreter, he talks about his quality of life.
I would say that another country, your lifespan is way shorter, and especially with all the complications that diabetes has, and the damages that happens in the body.
Monroy says he's able to afford his medicine and live a normal life thanks to places like Vibrant Health. Nurse practitioner Yvonne Ornelas-Rios describes some common issues patients have.
The diabetes, the hypertension, and the high cholesterol or dyslipidemia, they come in threes.
Those health problems and more are getting a lot of attention in the Kansas Senate race. Health care is a familiar topic to both candidates hoping to replace Pat Roberts. You see, Roger Marshall and Barbara Bollier are both doctors. An ad from Bollier goes after Marshall's record in Congress and is handling health care issues during a pandemic.
All while voting against protections for people with pre-existing conditions.
Truth Be Told looked into the claim against Marshall. It references a bill called the Patient Protection and Affordable Care Enhancement Act. The legislation, sponsored by a Minnesota Democrat, says it would lower drug prices, encourage Medicaid expansion, and protect people with pre-existing conditions. The bill passed in the House of Representatives on a party line vote, 234 to 179. Roger Marshall was one of those 179 no votes. And the congressman is not running away from that vote. In a statement, he called his action a vote against, quote, Medicare for all. He argues quality and innovation would be compromised. Instead, he says he's part of a Republican solution that solves the pre-existing conditions issue, increases patient choices, and decreases cost. On her campaign website, Bollier says Marshall's plan would result in underfunded high-risk pools, elimination of essential health benefits, introduction of short-term health plans, and cuts to Medicaid. While the politicians duke it out, Percy Monroy is just happy to know his health is under control.
With all that support, my life has been almost relatively normal.
For Truth Be Told, I'm Bryant Madrick, 41 Action News. Now back out here live, we're in front of a Barbara Bollier sign. We're in Johnson County this morning, and this is an area that people who know Barbara Bollier very well, because right now she's a Kansas State Senator, but before that, she served in the House of Representatives in the State House. And obviously, in this part of the state, people know Bollier very well. On the western side of the state, people know Marshall very well because he represents that part of the state in Congress in Washington. But over the weekend, there was the first debate between Bollier and Marshall, so everyone got a chance to know both of these candidates pretty well and where they stand on the issues, especially health care. One topic that came up was abortion. In fact, right now, you may see some ads right now slamming Bollier's voting record in the legislature when it comes to that topic. Right now, I am doing my next Truth Be Told story on the topic of abortion and the claims that are being made in those ads you see on TV right now. So that's our next story that we're working on. But healthcare is certainly going to be a big topic in this race between two doctors. Reporting live in Johnson County this morning, I'm Bryant Madrick, 41 Action News.
Really important reporting done there by Bryant Madrick. We appreciate his, and he said that he's going to have more of these series leading up to the election. Bryant, thank you very much.